Welcome back to Healthy Living, brought to you by St. Tammany Health System. We've been talking today about emergency services and the certifications that help the public know where to seek care in the event of a trauma, chest pain, or a stroke. We're speaking next with Toby Tournillon, who is going to talk with us about the Certified Stroke Center designation at St. Tammany Health System. Toby, welcome. We're glad to have you on the program.
Thank you for having me.
Yeah, excited to see you today. And we're talking a little bit about these certifications and how they help people know what's going on. A Certified Stroke Center. Talk to me about what that means and why that helps the public.
So we are a primary stroke center, and what that means is that we have the processes and protocols in place to care for the stroke patient from the time they arrive at our emergency department to the time of discharge. When a person arrives in our emergency department with symptoms of a stroke, care begins immediately so that we can quickly assess and provide the interventions necessary to determine if the patient is a candidate for TPA. So TPA is a medication that we give our stroke patients that helps. It's given through an IV, and it dissolves the clot over an hour.
Wow.
So the quicker we can get the patient TPA, the better chance the patient has for having a positive outcome.
Okay, so similar to what Jeff and I were talking about with a heart attack, and the faster we get care for that heart muscle, you're saying the same thing in the case of stroke. The faster we can get that patient and begin that care, the more likely we're able to make a difference in that stroke. And the way to stop that stroke is with TPA.
That's correct. So with a stroke, it's the same concept as with a heart attack. We also call it a brain attack.
Oh.
And so when you have a lack of oxygen flowing to your brain, which that's what a stroke is, it's a lack of blood flow, brain cells die every minute that you go untreated. So we say time is brain, and the quicker you can get to the hospital and get intervention, the better your chances are of recovering.
Wow. And that's where a primary stroke center obviously is the place to be. Not everyone can administer TPA, and if TPA, if it takes too long, then you can't administer TPA, is that right?
That's correct. We closely monitor our times from the time the patient arrives to how long it takes us to give TPA. And so our goal is within 30 minutes.
Wow.
And we accomplish that because we have that protocol in place to quickly care for the patient.
Outstanding. So one of the things that I think makes the difference for the primary stroke center is not just the emergency response, but the capabilities and specialties of the people on the team. And you're part of our neurosciences department. So can you talk for a minute about your role in stroke for neuroscience?
Yes, so neuroscience is a specialty that's really, the need is really growing in our community. And we are expanding our neuroscience program with the help of our Ochsner partners. We have the Ochsner neurosurgeons that are available to provide surgical interventions for those with surgical needs. We also have our Ochsner neurologists that are consulted and are available to help guide the care of our neuropopulation.
Outstanding.
We have now a dedicated neuro ICU and a neuro med-surg area that allows us to cohort our neuro populations in one area. And by doing that, this allows our nurses who work on that unit the ability to specialize in neuro. So it's really a growing specialty that we're really embracing.
Fantastic. So St. Tammany Health System neuro department has nurses who are specialized in neuro.
That's correct.
And then through the partnership with Ochsner Health, we have the surgeons and physicians who are neurospecialists.
Yes.
Outstanding. And together they're part of that stroke response as well as other types of neurosurgery, brain surgery, etc.
That's correct.
And then I think, you know, one of the things that we talked about, everything that we've been looking at is inside the facility. So when someone arrives at the hospital, the response is fast. We can administer that TPA. We have the neuro ICU. Those are all once we're involved. For the public, what can we do as lay people to prevent stroke or to be on guard to respond to stroke?
Sure. I think the most important thing for the community to know is the signs and symptoms of a stroke. And we like to use the Be Fast acronym.
Be fast.
Be fast. B-E and then fast.
Okay.
So B stands for balance. This also implies dizziness. Now dizziness is a very common symptom, but when you have dizziness in the combination with some of the other Be Fast symptoms, then that can be indicative of a stroke. E is for eyes, so we're looking at a sudden visual loss in one of the quadrants where they're unable to see out of maybe a portion or a piece of their visual field. If you look at the patient, they may have double vision, or like I'm looking at you and your eyes are straight, but when you look at a patient that could be having a stroke, maybe one of the eyes is pulling off to the side. So that falls under the E for eyes. Then we have F for facial droop. So ask the person to smile and see if there's symmetry from the left and right side of the mouth.
Okay.
Usually you'll see like a facial droop, or when they smile, it'll be a little bit off.
Okay. And then
A is for arms. So if you think the patient's having a stroke, have them hold their arms up for 10 seconds, just like this, palms down. And you're looking to see if one of the arms drifts a little bit.
Okay.
Or maybe they can't hold the arm down. So strokes are typically unilateral, so it's good to have them compare both arms at the same time if they can, and look for that drift on one side. Also with the arms, we're looking for any kind of sensational loss, maybe a loss of sensation in one side, either the face, the arms, or the leg. And this also applies to the legs, where you want to ask the patient just to hold their leg up for 5 seconds and see if there's a drift in that one leg, on that one side.
And so that was A, arm.
Arms.
Now we're to
So
S.
now we're moving on to speech. Lots of stroke symptoms that could be possible. So S is for speech. We're looking for slurred speech, or maybe the inability for the person to get the words out. So a simple thing you can do is say, hey, what is this? And what is this? And see if they can identify those items. Another thing with speech is maybe they can speak, but they don't understand what you're saying. And so ask the person to follow 2 commands. Say, hey, can you give me a thumbs up? Or can you show me 2 fingers? And see if they can follow those commands. If not, they may be having a stroke. And then T is for time, because time is brain. So we want to make sure when you do identify those symptoms, you want to note the time that the symptoms started, if it was witnessed. If it was not witnessed, it's important to determine when was the last time the patient was seen without any signs and symptoms. And we refer to this as the last known well.
Last known well.
Yes. So when we just identify the time the patient was last seen without any signs and symptoms, and we get them to the emergency department, if that patient arrives within 4.5 hours, they may be a candidate for TPA. But if they're outside that window, then TPA is not going to be an option for them.
Wow.
So time is really important. The quicker you get there, the more treatment options you have, and the better chance you have of having a positive outcome.
Perfect. So that's why be fast.
Yes.
Balance, eyes, face, arms, speech, time.
Yes.
Outstanding.
You got it.
Be fast to
Yes.
prevent a stroke or to take care of it really quickly.
That's correct.
Toby, thank you so much for coming in. This was really educational. I appreciate learning about the Primary Stroke Center and about Be Fast.
Thank you for having me.
You've been watching Healthy Living, brought to you by St. Tammany Health System. We talked today about emergency services and the certifications that can help the public know where to seek care in the event of a trauma, chest pain, or a stroke. I'm your host, Melissa Hodgson, and we'll see you next time on Healthy Living.